Generally, if you have been a smoker for more than 10 to 20 years and if your cough is not getting well, then it is important to get diagnosed. Take a test. Like a simple X-ray test or a CT scan may be needed. Sometimes these cough can detect a lung cancer. It's not that every cough is a lung cancer, but important to rule out lung cancer in smokers. In any way, if your cough is not getting well, it needs some sort of an intervention. Please consult your doctor and don't miss out. Maybe tuberculosis, it may be cancer. Sometimes it's better to catch it early so that we can cure lung cancers. Thank you.